when a couple is expecting a child, they are all excited. They don't know what to expect, especially in our setting, whether it's a girl or boy. They have no idea who it will look like. They have no idea how this baby will come out, but they're excited anyway. And when the baby finally comes, the excitement gets to another level. The baby gets all the rosy names you can hear about. Boo-boo, sweetie, mama, papa. Oh, everybody's excited to see the baby. And people move very long distances to come and look at the baby that was born. Now, when these children are growing and they enroll in school, when you ask every child who is in nursery to around P3, which is around 3 years to around 9 years, what do you want to be when you grow up? They will say, I want to be a doctor, a lawyer, an engineer, a pilot, a teacher, and all those rosy professions. But today in Uganda, we have very few doctors. Actually, our health worker to patient ratio is very high. We don't have enough lawyers to bring redress to all the cases that are in court today. The teachers are not sufficient, and you're asking yourself, where are our doctors getting lost from? What is happening to our lawyers? Where are they running to? Actually, we are losing our doctors, lawyers, engineers, and teachers at the age of 10 to 19 years. What is so special about this age? This age is called adolescence. Between 10 and 19 years, every child gets through what we call adolescence. And adolescence is a time in life when someone is getting aware of their body and they are really trying to explore and experiment with their bodies. They don't experiment with only their bodies, but what they eat, what they watch, what they drink, and all those, including their own sexuality. Now, what is the problem? We are losing our professionals to unwanted pregnancies, unplanned pregnancies, drug and alcohol abuse, STIs and HIV/AIDS. We are losing our doctors and lawyers to mental health problems that are happening in the community. Now, what is really happening? Why are we losing our professionals at that age? What happens is that today, there is a breakdown in the family system. We all know. These days, I think it's trendy, or it's a lot more than before that. There are a lot of single mothers raising children. There is no social support. Long ago, in Africa, in Uganda, people used to live with their relatives. It was the grandfather, the sons all around, and their wives and grandchildren. So there was a social support system. So as a parent, if you fail to try to talk to your child or you fail to discipline them, there is somebody else more than ready to discipline your child for you. It is not happening these days. Now, these days, children are being taken to grow with grandparents. And we know all about grandparents. They are tired. They did their beating, they did their talking. Now it is time to enjoy. Actually, for them, they are now enjoying life, not running around with an adolescent. And before you know, our children are being dragged by so many forces into all manner of things. Our children are taking alcohol. You look at a child who has come from a family where no one takes alcohol, and they are an addict. And you're thinking to yourself, when did they start? How did they start? What happened? Now, we also have a problem of poverty in the society. Because of poverty, so many children are being kicked out of school. Because of poverty, so many homes are breaking. Because of poverty, children are now experimenting. You know, when they are young, actually, to them, anything is something, as long as somebody has come to them to talk to them. Now, what is the problem? We have a new trend now, unlike our years, of social media. A lot is happening on social media. You know, before we would stand and argue, oh, the children who live in the cities are actually better off and the ones living in the villages. But today, the children in the city are very vulnerable. I told you earlier that I have adolescents. I have 3 of them, and one of them is here. Now, my daughter finished P7. But in my household, unless you work, you can't have a phone. So she gave out my phone. Today, I am on over 10 WhatsApp groups. You people should know what is happening. And P7 VAC is between 11 and 13 years, isn't it? You don't know the conversations they are having. So I read and think, can I do something? How do I even intervene? A lot is happening. Let's check our children's phones and understand what exactly they know, because they know. You know, children might look innocent, very innocent, because they know us. They know what we want. They know what we don't want. They act. And if they told you your child is doing this, believe me, you'll say it is a lie. But please, let's follow our children closely. So what are we going to do? There is a solution. There are known solutions to it. Let us continue communicating with our adolescents. Let's give them the right information, age appropriate. The adolescents between 10 and 14 years actually don't get the same information like those 15 to 19. But let's keep talking. What are we going to tell them about? You know, when someone hears sexuality education or information, it is not teaching them how to have sex. It's different. It is teaching them how to behave, giving them information on how to take care of themselves. They should know what a bad touch is. They should know who shouldn't be with them in a dark corner somewhere. I remember when we were growing up, our parents would tell us a girl does not move beyond 6 p.m. Today, at 9 o'clock, you find an adolescent, 13, 14, 15, at 9 p.m., moving unaccompanied, going to where you look where they are coming from, you're not seeing any activity. Where they are going to, but there is a lot of sexual and gender-based violence in the community. These girls are being raped and they don't say. You heard what Vivian said. They will keep quiet. You know why? In our society, when we are talking about sexuality, we do it on the negative side. They know it is bad. It's bad manners. So if she has had bad manners, she will not come and tell you, because you're going to start looking at her as a spoiled child. So what should we do? Give them information. Tell them that if this happens to you, come and tell me, or anybody you're comfortable with, because you can avert early pregnancies from rape if a child speaks out and they get the right information. But we're also telling them about being confident. Some girls are falling prey of men because they don't know they are beautiful. They don't know. So someone is telling them you're beautiful and they are feeling, oh my God, I am finally beautiful, to them. And they are falling prey. They are being taken advantage of because they are not confident. We are supposed to tell our children, the boys, their roles. Today, you find a boy who is dressing like a girl, and they are moving comfortably with earpins, with tight pants, But we are going to get into the same labor market with a person who is dressing appropriately. We teach our girls how to behave, and the girls are more vulnerable, by the way, very vulnerable. They are vulnerable to rape, vulnerable to defilement, vulnerable to all that. But the boys are also vulnerable. A lot of emphasis has gone to the girl child. But you know what? The boys are vulnerable in their own way, because during COVID, there was this story that ran. I didn't follow it so much, but it caught my eye. One boy of 17 years impregnated 12 girls on the same village. What a hero. 12, pregnant, same village. How did he do it? You mean the girls didn't know that now that one is someone's boyfriend or what? But it happened. So who is more vulnerable? Is it the girls? Is it the boy? Does he even know what HIV/AIDS is? Does he even know what it means to be a father of 12 at 17 when you're still living in your father's home? The boys are vulnerable, but they are not being paid attention to. And for us to be able to protect all of them, I think we should give them as much effort and as much concern, and we make sure we also bring them on board. So what happens? Our girls are getting out of school because of things like menstrual hygiene. They don't have the products. They don't know what to use. They have cramps, no one to talk to. They get out of school, then they end up getting pregnant, like sincerely. But you're with your daughter, she's turned 10, You've not asked her if she has got into her periods. You're supposed to ask every month until she finally gets into the periods. Because our children are actually not very empowered to speak out. They are shy. I remember when I was young, I was in P6. I think there was this little girl, and I think her mother got a morbidity. A morbidity is a sickness. After delivering her, and she became lame. So she was not very mobile like everybody. So when she grew a little bit, she came to school and said, oh my God, I saw my mom having blood. And you know what? And then I'm thinking to myself, at her age, she's supposed to have been talked to about menstruation, but also her mom was not so mobile to move away and go very far and what. But it shows a breakdown in the system because I think long ago, there was this information provided at the fireplaces. People would sit and the parents talk to their girls, not even girls, the girls and boys, and these things would come up in a polite way. Because giving information, the right information, the wrong way will also not help. It has to be the right information and the right way. So when you look at the source of information, who is supposed to do it? You people, did you get embarrassed during the lockdown? The number of girls getting pregnant are more. What does that mean? That the teachers are doing better than us. The parents, you have your baby, that boo-boo, that papa, that mama, and the mama is having a problem, and they cannot talk to you. The parents who loves them very much, there is a problem. Let's talk to our children. Let's get them closer. If you can't, find somebody who can get closer to them. I was in a class, I think last month, and then I was asking these students, can you tell me how you heard about sexuality and who told you about sexuality? You people, one said it was the maid. You're saying that maid was cool. Then one, it was school. Then one was in a convent somewhere. And no one said it was their parent. And then I asked, especially the one who said it was the maid, where was your mom and dad? They said, my mom, then my dad, but there's a serious problem, people. Let's not take it for granted. Internet will not raise our children. It doesn't matter how sweet and expensive the tab you're giving them is. It doesn't matter how much money you're giving them. It does not matter what you do for them. If you're not sitting them down to talk to them about their health, about their life, it will come back to you. Because one day they will say, my parents did not tell me. And trust me, it's the most hurting thing that can happen. Parents, let's take lead. Let's not leave it to the teachers who are speaking different languages. For us, we come in a society that is multilingual. Now, Muganda is telling your actually child about sexuality in the wrong language. You know how you twist one word from one language to another, and it sounds something very different. Let's take charge of our children's education about sexuality and their health. Let it come from you. That, you know what, this is a bad touch. You know what, when someone tells you, find me in the corner at night, they're actually going to do this. You know, keep an eye, how they walk, what happened to you. Because for me, I ask my daughter, why are you walking like that? What's happening now? And you know what, somehow, slowly, you don't have to make it a 1-hour lecture, but slowly by slowly, you'll get the point home. You know, even watch news with your children. There are always defilement cases. You say, you see that defilement case? Should have been averted if we had done A, B, C, D, and E. Now, if we talk to our children and they are aware, especially, we have to tell them where to seek services. Children these days get candida from toilets. But they can't tell you because you'll think they actually had sex. Then they will keep quiet. But if they have the right information on where to get these services, they will go to get the services. And now, what is needed? We need services that are adolescent-friendly, but also adolescent-responsive. The government has tried. But I think it's high time that private practitioners come up with services that are adolescent-friendly and responsive. What does that mean? Like Vivian said, you go to a health facility, adolescent-friendly. The structure is there, the services are there, but the nurse is very old. How are you going to tell her at 15 that I want pills? She'll be like, oh, You are a young girl. What are you doing with pills at this time? But if we have the right people to work on these children, they will go. You, the parents, won't even know that they had the disease and it cured. The most important thing is for them to cure so that it does not come into a lifetime morbidity because it was not attended to on time. Responsiveness, what does it mean? You look at adolescents, you understand their problems, then you come up with services that respond to their problems. Now, the services are there, the equipments are bought, the supplies are there, but it is not responding. You're forcing them onto services. Ask them. Get to know what they want so that you're able to respond to exactly what their needs are. You might want to come, let me give an example, with family planning. It's not what they want. Maybe they want condoms. But if we know what they want and we give them exactly what they want, they are going to be helped. Then there is a problem of these children who get pregnant in their homes and the parents are not supportive. Don't blame these girls very much when they get pregnant. Where were you? I keep telling people that it's a joke, that if God wanted us to protect our children, he would be collecting all their private parts and handing them over to us, then on the wedding night to give it back. It's not that way. God gave everybody their own part, and now as a parent, do your part. Talk to them. Try your best. You know, everybody thinks my dad was very tough, but he did his work. My dad would come and say, me, I have eaten enough sugar cane, I've eaten enough sweet potatoes, I've eaten enough cassava. Even if I died, it's the right time. You have to keep yourselves. You're going to get HIV and I won't take care of you. Believe me, you would not mess because you know there's no way you're going to walk back there. And you know, everybody who would have HIV in the family, they would take us. They would take us to see how painful it is. So you come back a reformed person. You start refusing to pick those phone calls that are tricky. You're just thinking, if I got into that state, I would get embarrassed. Then, if these girls get pregnant and we are also harsh, we are not going to have our doctors. You people, they give birth and go back to school and become doctors, don't they? But if we give up on them because they've done one mistake, just because it has evidence, then we are missing our doctors, we are missing our lawyers, we are missing our engineers, and we are not doing anything. Because when we educate a nation, then we are sustainably going to achieve our development goals, because these are the futures of tomorrow. Let's make sure the girls that get pregnant are rehabilitated and taken back to school. But then we have to involve adolescents in leadership. When we were in school, you can do everything you want, you make noise, you don't tuck in. But the moment they say you're a prefect, trust me, you cannot go to class with a dirty uniform because you're going to be exemplary. So if we give these adolescents leadership positions, they will start changing because we shall have people who will go back to talk to the others that are not in leadership, and the situation will be better. And those who are not able to go back to school, let's get them livelihoods. Your daughter has got pregnant, she has given birth to a child, she's at home seated. And yet she can do any petty trade to earn her own money. Because if she doesn't, somebody is going to give her the money and she'll get pregnant again. Then you'll want to blame her for all that, yet the two of you, the parent and the child, actually had to work hand in hand to make sure this happens. So, ladies and gentlemen, it is not one person's battle. Let's join hands, the parents, the teachers, the community leaders, the religious leaders, everybody. Let's join hands and give an enabling environment for our adolescents so that they can get into a future of possibilities. Thank you.